Hello, ladies and gentlemen. My name is Rostime Hermayerni Simanulang. I came from Biology Department, Program Doctoral of Universitas Sumatera Utara Medan. Because of pandemic COVID-19, my oral presentation on 5th International Conference Biological Science and Biotechnology 2020 by online.
Ladies and gentlemen, my title of research is Description of Cervix Cancer Histology after given andaliman Zantoxylum acanthopodium DC methanol extract to rats induced by benzoapyren. Introduction. Andaliman is a unique spice from the province of North Sumatra, Indonesia. Andaliman extract contains alkaloids, steroids, and terpenoids having antimicrobial activity against insect, bronchitis drug, dyspepsia, antiviral, anticonvulsant, antifungal, analgesic, antibiotic, hepatoprotective agents, cancer, and preeclampsia. Andaliman can also have anti-inflammatory and antioxidant activity. Cervical cancer is a cell that has an abnormal growth in the cervix that causes tumor growth. Malignant tumor causes cancer. Cervical cancer is also the second cancer that attacks humans in Indonesia after breast cancer. The World Health Organization has issued a world resolution against cancer. Because of the high mortality rate, in the coming year it will be signed to all countries in the world to carry out cancer control programs nationally. For developing countries, in the control of cervical cancer, early conventional detection program based on conventional cytology have been carried out, but there are constraints on technician and infrastructure. In innovation from typical regional plants that have anti-cancer contents are now being developed. One of the blends that has the content is andaliman fruit. The aim of this study was to determine the role of andaliman methanol extract in cervical cancer cell. Material and methods. The study used 24 female red ratus navragicus from Animal House of Universitas Sumatera Utara, handling of experimental animals in accordance with the requirements of the applicable code of ethics. Animal model cancer through injection benzoapyren 50 mg per kg body weight, then left up to 3 months, then growth of cancer. After then given andaliman methanol extract while 30 days. Now, the RECIST method was a completely randomized design experimental method with 4 treatments, namely control group, injection of benzoapyren in rat cervix, injection of benzoapyren in rat cervix plus 300 mg per kg body weight of andaliman methanol extract, and then injection of benzoapyren in rat cervix plus 400 mg per kg body weight of andaliman methanol extract group. The parameters of this study were body weight, SGOT, SGPT, creatinine, ureum, then cervical histology. SGOT, SGPT, creatinine, and ureum were carried out in Medan's Health Laboratory. Body weight and cervical histology were carried out in Anatomical Pathology Laboratory and Animal House of Universitas Sumatera Utara. A result and discussion. Based on the result of research that benzoapyren induction could affect the value of SGOT, SGPT, creatinine, and ureum. The highest SGOT value was on T3 and lowest was the control group. You can see on figure 1. Giving andaliman extra in T3 dose greatly influence SGOT value. The highest SGPT value were benzoapyren induction or cervical cancer rate. You can see on figure 2. Andaliman in nanocells also affected the SGOT and SGPT value in rats. Substance from benzoapyren could affect the SGPT in function of rats. However, the highest ureum value were at the highest andaliman dosage and the lowest were in treated cancer rate. And then you can see on figure 3. The level of fresh ureum of cancer models were lower because the kidney could still function properly, so that the urea could still be excreted through the kidneys optimally. Besides, urine level in the blood could be influenced by many factors. For example, it can decrease in the condition of liver failure, lack of protein intake, malnutrition, and overhydration. The creatine parameter was also observed. However, the T2 dose had the highest creatinine value you can see on figure 4. Red creatinine levels could theoretically trigger kidney disorder, in addition to malignant hypercholesterolism occurs, which could be defined as excessive breakdown of metabolites. During the inflammatory process, excessive protein breakdown occurs due to the action of pro-inflammatory cytokines. Based on this data, it is known that benzoapyren induction and andaliman administration could affect the SGOT, SGPT, creatinine, and ureum levels in cancer rates. Cancer could also affect by weight due to cancer patient food intake, not only caused by the influence of chemotherapy, but also influenced by compounds produced from cancer cells, namely serotonin and bombensin, which can affect brain chemoreceptors, so that cancer sufferers lose their appetite or anorexia, so that many cancer sufferers experience a drastic loss of body. Cervical cancer arises between the epithelium lining the ectocervix or portio and the endocervical canal of the cervix called squam columnar junction or SGCG. Histologically between squamous complex epithelium of the portion with a short cuboid or cylindrical epithelium of the ciliate layer of the cervical endocervical canal of the cervix canal. Inflammation is seen in T1 to T3. Inflammation causes the development of a normal cervical cell shape, giving methanol andaliman extract cause a little reduction in the shape of cancer cell in the cervix but has not been able to improve the cell to the maximum. Histology and differentiation of cervical tumor are translated in the better to the better understand the biology's basis. Conclusion: there were changes in cervical cell in the treatment group compared to the control group, and there was increase in the SGT, SGPT, ureum, and creatinine value of females raised injection with benzoapyren. Then it is necessary to analyze the dose of application of andaliman as a future cancer drug. There is a difference on histology in the cervical cancer cell of rats after given the methanol extract of andaliman. So andaliman can be recommended as a herbal medicine for cervical cancer in the future. An acknowledgement. The study acknowledges grant support from the Educational Fund Management Institution or LPDP, Ministry Education and Cultural in Indonesia by doctoral research program. Thus my presentation and hopefully useful. Thank you.